Hello and welcome to Buddhistdoor Global's weekly news review. I'm Justin Whitaker, Senior Correspondent for BDG, speaking to you from our offices in Hong Kong. As you will have noticed, we've been away for a while. Our last weekly news review was posted January 21st of this year, just as news of the imminent danger of the novel coronavirus was reaching us in Hong Kong. Our city and our management at Buddhistdoor Global moved quickly, and today we are fortunate to be in good health and in a region of over 7 million people with relatively few cases of COVID-19 at just 1,056 and only 4 deaths over 4 months. As public health conditions allow, we are returning to work at our regular schedules and thus returning to our weekly news review. And as face masks such as this one help us protect those around us in offices and in video shoots, I'll be wearing mine as long as is needed. In this week's news review, in India, the foundation of His Sacred Majesty, a Buddhist-inspired non-profit organization headquartered in the Indian city of Chennai, formerly Madras, in the state of Tamil Nadu, has provided an update on its recent emergency relief and rehabilitation operations to provide vital emergency aid to underprivileged and vulnerable communities living under lockdown in India. The foundation observed that the nationwide lockdown has brought countless lives to a standstill, most impacting the poorest across the country. The hardest conditions are faced by children, women, and the elderly. The foundation's emergency relief fund is now being used to provide members of India's most vulnerable and ignored communities with basic necessities such as basic hygiene and food staples. In the United States, Vietnamese Buddhists in New York and California are working to make much-needed personal protective equipment for medical personnel. Buddhist monastics and temple volunteers have independently organized to produce face shields for medical workers in their communities. In New York, Vietnamese Americans from the Tan Tin Temple in the city of Rochester have produced 5,500 face shields for Rochester General and Strong Memorial Hospitals. Across the country, in Riverside, California, monastics from Pat Tway Temple are working alongside monks and nuns to produce some 600 masks a day for frontline health workers in their area. The work of both temples reflects efforts carried out by Buddhist organizations, large and small, across the world. As restrictions prevent monks and nuns from carrying out their regular meetings with temple members and the public, many have sought ways to put their practices of compassion and generosity into action to help fight against COVID-19. Meanwhile, amid a successful containment response, COVID-19 infections in Buddhist Bhutan have risen to 21. As of today, May 18th, there are 21 confirmed cases of the novel coronavirus in Bhutan, an increase from just 11 a week ago. All recent cases are of Bhutanese nationals who have been traveling in the Middle East and are currently in quarantine facilities in Thimphu, the nation's capital. Bhutan was quick to adopt a comprehensive evidence-based tracing and testing regime and to put in place strict quarantine procedures and border controls to avoid overloading its healthcare system. The coordinated response has been bolstered by the nation's traditional communal values, in which all levels of society, including the royal family, have acted in unison to observe social distancing and support other response measures, and the country's free universal healthcare system, a key aspect of the kingdom's gross national happiness philosophy since the 1970s. Buddhist temples have become soup kitchens across Thailand. As Thailand continues its struggle to contain the novel coronavirus outbreak, Buddhist temples across the country have come to the aid of those in need. Nearly 1,000 soup kitchens have been created in and near Buddhist temples in Bangkok and all of the kingdom's 76 provinces to cook food for low-income earners and others in economic distress. Thailand was the first nation outside of China to confirm a case of COVID-19 in January. Since then, a number of government and social measures have helped keep the pandemic under control in the nation of some 69 million people. Food has also been distributed to smaller temples throughout the country, as many monks are avoiding their regular alms rounds to reduce social contact that would potentially spread the virus. And lastly, Buddhist monks in Cambodia and Thailand limit their religious services due to the pandemic. With strict stay-at-home orders and social distancing measures limiting normal social interactions, Buddhist monks in Cambodia and Thailand have adjusted their daily habits and religious activities to help prevent the spread of COVID-19. While many monks are using live streaming to reach their followers and offer prayers virtually during the celebrations such as Vesak, which commemorate the birth, enlightenment, and passing from this world of the historical Buddha, many other religious rites, such as those held for the traditional Lunar New Year, have been scaled back or canceled altogether. Although many monastics perform their daily alms rounds outside the temple, other ceremonies, rites, rituals, and celebrations are being adjusted, restricted, or canceled. As of today, May 18th, the Cambodian government has reported a total of 122 confirmed infections and no fatalities, while the Thai government has reported 3,028 confirmed infections and 56 deaths. That is all for this week's BDG News Review. If you enjoy regular news videos delivered to you each week, please subscribe, give us a thumbs up, and share this video with friends. We appreciate your support and feedback in the comments below, and be sure to check out our website, Buddhistdoor.net, for these stories along with features and special coverage of Buddhism around the world.